Well, it's quite historic, and for many people, it was actually unexpected to see so many healthcare workers to walk out of their jobs. It all started just earlier this week when their labor contract was going to be renewed, but just overnight between the union representing these healthcare workers and Kaiser Permanente, the corporation itself, there was no agreement, and this was kind of a very sudden last-minute action. They decided to call it initially a three-day strike that started on Tuesday. So today's the second day, and on Thursday they're going to go out on another strike. And it was quite visual to go out there to one of their major facilities. You could see hundreds of them pouring out into the streets and getting quite a bit of support from people driving by. They were honking their honks, and it's really an exciting one, because a lot of the people I talked to, they're saying, you know what, we have done so many sacrifices during the COVID-19 pandemic. We were hailed as heroes back then, but a lot of them I've spoken to, they said they've been working there for 5, some of them 10 years, and they haven't received any of the raises that other physicians, doctors, for example, typically do receive. So to clarify, these are people who are not doctors. These are technicians, nurses, and a wide range of positions in these healthcare systems. They have not received the pay raise that they expect to see. Take a listen. This is what some of them told me earlier.
This state is very expensive. I love where I'm from. I love my community. I love to be a part of this community. However, the going rate of a one-bedroom is $2,200. That is ridiculous, okay? We all commute. We can't live right here in West LA.
You know, there's a burnout that happens. You can only do that for so many days, have these crazy busy days where you're just nonstop going, you know, trying to use the restroom and get all your water in and still keep up with patients. And the other thing is that the patients don't get the care that they need, you know.
What we know so far is that there's still not been any progress in these negotiations. As I mentioned, Thursday will be another day of strikes. After that, it's unclear, but I've spoken to many of those striking workers. They said, you know what, if they're not satisfied with the new contract, they're going to be still outside striking, protesting, waiting for the right contract that is going to satisfy them. Now, until now, Kaiser officials said that yes, there could be some delays, some reduction in the clinic hours, some of the non-urgent procedures could be postponed. They're already feeling the effects of this strike, but they are also looking to outsource other health workers to bring from outside. It's not clear for how much longer they could really mitigate this situation. But what's really interesting to see here is that if you look at the bigger picture, this has been an entire year of just labor disputes and strikes. Health workers are not alone. Inflation is really high, the cost of living is going up fast, and this is being felt across several sectors. Earlier this year, just here in California alone, I have reported on strikes by port workers, nurses, school teachers, postal workers, Amazon workers. The list goes on and on. Just this week, Hollywood writers ended their strike, but actors are still on a strike. If you look at the big picture, this really seems to be a big year for labor movements coming out there, calling on their members, saying, you know what, if you are not satisfied with your pay, go out and strike. And it's becoming a sort of a pattern where here in California, at least just this year alone, we have seen this in so many industries.